Hey guys, Tony Maritato here, licensed physical therapist. So at the time of recording this video, it is December 22nd, 2021. You should already be planning for strategies to handle the new year coming, and specifically I mean, how are you going to manage deductibles and insurance resets? I want to share a couple strategies that might be beneficial to those of you who have the ability to control your cash flow. And so one of the easiest things, if you guys are like me, you have a significant number of Medicare beneficiaries. Now, Medicare beneficiaries, in my experience, are not planning on or preparing for or expecting to pay deductibles. So I've got another video on the channel. You can check it out. I'll put the card up there that talks about how you can check the secondary or the supplemental insurance to know if the supplemental is going to pick up the Medicare Part B deductible. But if you find that the Medicare Part B deductible is not going to be picked up by the supplemental plan, and you know that the patient is going to owe the Part B deductible, but you also know that the patient totally doesn't understand that they're responsible for that Medicare Part B deductible, you might be better to hold those claims. And so let's talk about this for a minute. So I've got scenario number one. I run a business, I'm treating a patient on January 1st, and that claim is going to be applied to the Medicare Part B deductible. I've already established that the supplemental plan does not pick up the deductible, and so that patient's going to be responsible for it. What I would do is, if I'm not depending on that money, if I can wait, Medicare has a 12-month timely filing limit, meaning as long as I get my claim into Medicare to process within 12 months of the date of service, they're going to pay the claim. It's within the timely filing limit. So if I hold on to that claim, knowing that this Medicare beneficiary is going to have additional medical services, probably in January, February, March, I'm looking at about a 90-day delay. But what that does is it allows me to hold the claim, submit it once the Medicare deductible has been satisfied by another provider, and then I receive the full allowed payment from Medicare rather than putting the burden on the patient. And so I think that goes to improving the patient care experience. I'm going to collect the money either way. I've signed the contract, I've agreed to collect the patient responsibility if it's due. But what I didn't agree to do is to force that patient to pay when I have other options. So we know patients don't like to pay. Patients don't like pulling money out of their pocket. They feel that they've paid their insurance premiums, they've paid into the system. I don't want to put a bad taste in their mouth every time they come to therapy in early January. So at my practice, my business model, the way that I improve my patient care experience, the way that I make it less friction for my patient to continue coming to therapy, is we verify benefits on all of our patients, not just Medicare. Those patients who have a deductible that's going to reset in January, if I believe to a reasonable doubt or a reasonable expectation that their deductible will be satisfied by other services that they're going to receive, I'm more than happy to hold on to the claim, but you have to be mindful that not every payer has a 12-month timely filing limit. Some payers require you submit a claim within 90 days. United Healthcare is famous for that. Anthem Blue Cross Blue Shield just switched their policy. It used to be 12 months, now it's 90 days. So I have to take into account several factors. One, do I believe the patient's going to satisfy the deductible by seeing other providers? Two, can I delay the collection of that money, or do I need the money right now to continue operations? And three, do I know the timely filing limit for that payer? Do I have a good enough system in place that that claim doesn't just go forgotten and it never gets recouped, or it goes past the timely filing limit, in which case I'm not eligible for reimbursement? Those are all factors that come into play here. But the better you manage your business, the better you control cash flow. It's always preferred, at least in my business, it's always preferred to have the insurance company pay the full allowed amount rather than having to track down the patient to collect money from them. Also, don't forget, bonus, if the patient's going to pay me, they're probably going to put it on a credit card. That means I just lost another 2.5 percent to credit card fees. Or they're going to write a check, which means I have to make a trip to the bank or scan the check, and I've got deposited items where I know for my bank account, once you go over a certain threshold of the number of deposited items, there's an additional fee for each extra deposited item. There's always more work, but if I can get direct deposit from Medicare, and I know Medicare is backed by the US government, I'm going to let Medicare pay the bill. So these are some strategies that I want you to think about moving into the new year. These are strategies that are effective for not just Medicare beneficiaries, but all third-party payers. And in the next video, I'm going to talk about this topic again, but I'm going to talk about it relative to why it's in your best interest, but also why it could save your patient $1,000 if you don't submit your claims immediately. You wait for other medical charges to go through and process to the insurance company, and then you submit your claims after that. So if you're interested in that, keep watching the channel. I'll catch you on the next video.